A very good morning to you, wherever you are watching us from. It is a Thursday. The month is of March, the year 2014. Welcome to the program, Good Morning Kenya. And today we want to understand matters to deal with some of the diseases and what you need to do to ensure you overcome those particular diseases. And this morning we want to focus on arthritis and want to enable you understand what arthritis is all about. And to help us understand that particular topic and discussion is Dr. Omondi Oyoo. He's a senior lecturer at the Department of Clinical Medicine at the University of Nairobi and is as well a consultant physician. If you have any question for Dr. Omondi Oyoo, the number is 20511. You can start with the word GMK, or you can as well email us on gmk@kbc.co.ke. and we'll be more than glad to sample some of those comments. Of course, those social contacts are now scrolling down your screen. We'll be more than glad to sample some of them in the course of the program. To take you through the program, my name is Martin Mwanje. Karibu to the program. Daktari, welcome to the program. Good morning, Kenya.
Good morning. Thank you.
And I know you have a lot of experience in matters arthritis and indeed understanding arthritis. Maybe just to begin with, what is arthritis? And of course, it has been referred to as a silent menace within.
Thank you. Arthritis is painful swelling of the joint. So it's a complaint by the joint that there's something wrong within the joint or within the body. Mm-hmm. Yeah, so that's what constitutes arthritis. And in and of itself is not a diagnosis, but it's just a saying that there's a problem with the joint. But when you're saying arthritis, it means the joint is swollen. That differentiates it from what we call arthralgia, where there's pain of the joint, but there's no swelling. Mm-hmm. Yes.
And why is it referred as a silent menace?
Because most of them, you may think that the joint is just painful and swollen, but it has the devastating consequence of making the joint, destroying the joint and the joint failing. And therefore, you are paralyzed and confined to a wheelchair or immobile, and you are unable to engage in activities of daily living. So when the joints are complaining by being painful and swollen, then you should take action. Mm-hmm. Yes.
And sometimes give us some background in terms of its origin.
Most of the causes of arthritis are not known, but we have close to 200 forms of arthritis. And the causes vary from type to type. The commonest type of arthritis is called osteoarthritis. And this afflicts people, mainly people of older age. It's usually the end, or we call it the joint failure. The cartilage in the joint is destroyed, mm-hmm. and it is degenerated, and therefore the joint is painful. And sometimes there can be loss of movement of that particular joint. The second common type is rheumatoid arthritis, which is autoimmune, that is self. You fight yourself. Mm-hmm. The antibodies within you are not agreeing, and they form some complex which go to the joint, and in the effort to remove that complex, your body destroys the joint. And commonly afflicts women with the ratio of 3:1. And the cause is actually not known, but we know that there are some people with some genetic predisposition to get that form of arthritis. Mm-hmm. Then the other type is gout, which is very common too. And gout is because of high production of uric acid in the body. It could be because of genetic reasons, or could be because of a production of uric acid, either because of ingestion of certain substances or foods that lead to high amount of uric acid. And this one is commoner in men, and we know that it has dietary and intake consequences, reasons for its being, and it's a rising problem. Mm-hmm. in the world, and in this country. It's one of the growing epidemics in this country, and it's very painful, and we know that the cause is high uric acid. Then we have other forms of called reactive arthritis, where somebody can have some infection, either in the urinary tract or the gastrointestinal system, and the body reacts to the infecting organism and causes some form of arthritis. Then there's a variety of arthritis that can affect children. The autoimmune type and various types of, we call them juvenile idiopathic arthritis. So this dispels the notion that arthritis is a problem of the old people. Children get arthritis too, and we need to take note of that. Then we have injury, trauma, the road accidents, and various forms of injury causes various forms of traumatic arthritis and predispose to secondary osteoarthritis. Among the top ones, I will mention also a condition we call lupus. Although affect very many systems in the body, but one of the key manifestations is arthritis. And they have many other complications, so pain and swelling of the joints. And this is an autoimmune problem also, like rheumatoid arthritis. And there are many other types of arthritis that one can talk about. They go to over 100, but those are the main ones.
The main ones.
Yes. Yeah.
Out of the main ones that we've talked about, which are the most common in this country? Because maybe we're looking at it from a global perspective, but in this country, which one are the most common ones that we keep encountering?
The commonest is osteoarthritis, which affects virtually over 50% of people above the age of 50 years. And they come with pain and swelling of the joints, the limping around. Most of the people using walking stick have got some form of osteoarthritis, and especially for the knee joint and the hip joint. And these will eventually require rehabilitation and subsequently even a joint replacement. So osteoarthritis is the commonest. And I think it is commoner than many issues that we talk about in this country. It's even more common than, for example, HIV, osteoarthritis. Then we have rheumatoid arthritis.
Let's focus on osteoarthritis that you're talking about. You talk about the symptoms, you talk about being the most common ones, the common type of arthritis in the country. If one has that particular kind of disease, what should he or she do in order to overcome? Or say, what's the medication for osteoarthritis?
The first thing, in terms of arthritis in general, when you have a painful swelling of the joint, you should seek medical attention. And the purpose of this attention is to make diagnosis so that your arthritis is characterized and the cause characterized. And then you are, once you say you have osteoarthritis, we have very many interventions depending on the stage at which it is. One, we give you pain medications. And I think the biggest reason for use of pain medications is osteoarthritis. And now, secondly, we work together with the physiotherapists to give you some form of rehabilitation. The rehabilitation can take the form of strengthening the muscles and the soft tissues around that joint to make it work better or less pain-free. Can take the form of helping you to reduce the pain or give you some devices that will make the pain bearable. There are some medications that we can also inject into the joints to reduce the inflammation and to reduce the pain. With this combination can go for a while, but once the joint fails completely and you are not able to sleep and not able to perform well, we have ultimately joint replacement. If the joint is replaceable, like the knee, the hip, the shoulders can be replaced, sometimes the wrists and the elbow. But here in this country, we commonly replace the knees and the hips. Yes.
And being a specialist in this area, say somebody is in rural areas, for example, and is suffering from osteoarthritis. Is it possible that the various health facilities we have at the grassroots level can offer the medication for this, or one has to travel all the way to, say, Nairobi to look for the treatment?
The answer is yes and no. No, because we have improved the curriculum at the university for teaching students with arthritis and on arthritis and other musculoskeletal diseases. So the doctors there in the district hospitals are able to make a diagnosis and provide some treatment, and pain medication are available. Secondly, the rehabilitation facilities like physiotherapists do exist even into the district hospitals. However, some of the district hospitals are not equipped enough. But in terms of surgery, the patients may have to travel probably up to Nairobi to get hip and knee replacement. That's the only area. But we are working on something we call the Oyoo Rheumatology Initiative, where we go to the various counties. We have already covered 10 counties to train the primary health care doctors in early diagnosis and management and early referral of patients with musculoskeletal disorders. And if we get support in this, we'll be able to cover all the 47 counties, and this will be able to increase the diagnostic ability of the primary care physician and reduce the morbidity, the disability and the pain that the patients with arthritis suffer. And within that Oyoo Rheumatology Initiative, we also have a patient program where we teach the patient on self-management. And therefore, the combination of these should be able to reduce the suffering that the patients undergo, and be able to may help them to make informed decisions in terms of treatment and how to move forward.
So we are saying that the Oyoo initiative, you came up with it because of the fact that medication of this particular disease is not that up to standard at the grassroots level.
Yes. First of all, the doctors and the other primary healthcare physicians were a bit rusty. So we were just trying to brush them up so that they bring arthritis on the fingertips in terms of diagnosis and management. Number two, once they know this, because the doctors, the clinical officers, they are the ones also who manage those health facilities. Once they know that arthritis is there and it's a serious issue and it is important to deal with it, they are able also, because they sit in the management boards or management teams of the various health facilities, they are able to ask and advocate for medications and other appliances that are required at the grassroots level. So it is sort of making them awake so that they understand arthritis, its implications, and the fact that it can be helped at the grassroots level. The reason why we're doing this, because musculoskeletal disorders, the arthritis and its related complications, is the leading cause of pain, and is the leading cause of absenteeism from work, and is the leading cause of early retirement from work, and is something that we cannot take lightly. Yeah. And if you take, for example, fracture of the neck or femur due to osteoporosis, its effect in terms of death is just equal to those deaths due to breast cancer. So 20% of them will die if they are not well managed. And therefore, it's a serious issue. That's why we are going into the grassroots to enable the people using the Oyoo Rheumatology Initiative so that they can give proper management when it is needed. Yes.
So we've talked about osteoarthritis.
Yes.
Let's talk about the symptoms of rheumatoid arthritis. How do I know I have it, and at what point do I seek for medical intervention?
Rheumatoid arthritis comes with pain and swelling of the joints. As opposed to osteoarthritis, which can affect the knee or just the hip or just both knees. This one affects virtually all the joints, especially the small joints of the hand and small joints of the feet. So you wake up in the morning, the fingers are stiff. You are not able even to make a fist. You are not able to move your fingers. You cannot even button your shirt. You cannot tie your breast, your bra if you're a lady, or even comb your hair. And this thing moves on and eventually can lead to deformity of the joints. And this one, immediately you get this, you should get medical attention as soon as possible. One of the things that we know about rheumatoid arthritis is that if it's not properly treated, 50% of them are not able to work within 5 years. And by 10 years, many of them have retired and are not leading meaningful lives. And therefore, unlike osteoarthritis, which is degenerative, this one, there are medications medications are available to attend to this thing, to the rheumatoid arthritis and treat it properly, and we can even go into remission. Yeah.
In terms of medication, how cheap or expensive is it to treat rheumatoid arthritis, or arthritis in general?
Arthritis it depends. There are various types of medications. You have the pain medications, which are also, because of their long-term usage, they are expensive because they're used for a long time. But we also have expensive medication, the biological drugs, which run into hundreds of thousands of shillings. And therefore, the reason why we are bringing together the patients and making them understand the seriousness of arthritis is so that they can also be able to advocate through the Ministry of Health and other government agencies for the reduction or removal of duty on the medications used for arthritis. So you have, for example, drugs like methotrexate, which are reasonably affordable, hydroxychloroquine, which is affordable. But within the spectrum, we have some drugs we call biologicals, which are all available in this country, but they're expensive. Like if you take this one you call rituximab, for a full dose every 6 months, costs close to 1 million. But that may look expensive. But look at a patient who will be unable to work, will retire, and will not be productive. If you put 1 million in this patient, and it is 1 million because of heavy taxation, if you can reduce the tax, help this patient to lead a normal life, then the patient will remain productive, and that 1 million will pale into oblivion. It's not really that expensive. Because we are talking about not rural folks, we are talking about lawyers, doctors, name it. Arthritis has no boundaries.
But assuming it's a rural folk, Dr.
Yes.
Does it mean that it becomes that difficult in terms of getting treatment for arthritis?
It is
because we're talking about close to 1 million.
No, we are talking about the high end. The high end.
Yes, the low end.
The lower end, we are talking about hydroxychloroquine, which is about 20 shillings per tablet, and it's about 40 shillings per day. Methotrexate is close to 20 shillings, let's say 30 shillings per week. And if you add with pain medication, which is about 20 shillings, we are talking about, let's say, 100 bob per day. So that's about 3,000, which is still high for the rural folk. And that's where we need some sort of government intervention. HIV treatment, for example, is free of charge, but it's much more expensive than that. If people were to pay for it. So saying that some investment, some tax should be tax relief on medications, and the drugs should be made available. 3,000 shillings, I think, is reasonably good for something which is affecting many people in the country. However, this is at commercial rate. In government hospitals, there's usually some subsidy when you get drugs from government hospitals. The only thing is that they are not much stocked with these drugs. And that's where we are going to the doctors who work in the rural areas. Because when they sit in those boards and those drugs are ordered, they'll be available at much lower cost to the rural folk. And I think they'll be affordable. Because once they are able to access the facilities, they are able to subscribe to the National Hospital Insurance Fund, which is available to everybody. I think they should be able to afford these medications.
I want to paint a picture. Supposing when we talk about rheumatoid arthritis, and say we have a patient, somebody is in rural area, say in Migori, and he's suffering from rheumatoid arthritis.
Yes.
What will you advise that as he or she seeks from medical attention, what will you advise, how does he or she go about it in terms of seeking for medical attention? There's somebody in rural area, and here is the joints, say, swallowing, getting swell. How does one go about it?
When you are in the rural areas and getting painful swelling of the joints, in every district hospital now, there are medical officers. Number two, in every county, one of the county hospitals, there must be a physician. And the physicians and these medical officers who have been come out from the University of Nairobi are able to make a diagnosis of rheumatoid arthritis and at least put you on some meaningful treatment. And we are always in contact in our rheumatology clinic at Kenyatta National Hospital with these physicians. And sometimes when they have difficulties, they consult over the phone, and we are always assisting them. And through the Uwezo Rheumatology Initiative, we are also meeting these physicians. We train them as trainers, and they also go and train. And when they are training, you cannot train without yourself getting well acquainted. So this person should make sure he's seen by a medical officer or a physician within the county, and that should be able to help the person. But we are always open to have these patients referred to our rheumatology clinic at the Kenyatta National Hospital. We are busy though, but we are able to see them and chart out a management strategy which we can share with the physician, and the physician will continue managing them. If once we start, we want this patient, we treat them to target. When the patient go into remission within 6 months. So we want the patient to get adequate medication. That's why we don't fear, even when they are referred to Kenyatta, we will put them on proper medication and send them back to that physician and tell that physician, this is what we want you to do with this patient. And that way we have been able to help many patients. But generally, there are physicians in every county hospital where their interns are being trained, and this should be able to help in proper management of patients. But in big cities like Kisumu, there are also other private physicians, most of whom should be able to make a diagnosis and manage rheumatoid arthritis. But if they in doubt, they are all open to come to Nairobi if they are able to.
But I guess the problem starts when a patient needs to undergo surgery, is it not?
Yes.
Because they have to travel all the way to Nairobi, like you did say, in most cases.
Yes, they have to travel, but it's not just Kenyatta National Hospital. I'm sure some of the big hospitals like Jaramogi Oginga Referral Hospital, the Moi Teaching Referral Hospital, and there are various mission religious faith-based hospitals like Kijabe, Nazareth, and Kikuyu, which are able to offer joint replacement surgery to the patients, and all these put together, they are not enough, and very many private hospitals in Nairobi. So the cost that we are talking about is the cost of the appliance that you put in the joint, and this is where again the government should come in to reduce the cost. It is not a luxury thing that you should put 100% tax on an appliances, which is just going to be used to help those who are suffering. So if the cost of the appliances is reduced, this will help. But again, the University of Nairobi now is training orthopedic surgeons and Moi Teaching and Referral Hospital. So I'm looking at a situation where orthopedic surgeons will be found in all the county hospitals, and surgery, joint replacement surgery, will be available even in the county hospitals.
Maybe if you talk about orthopedic surgeons, if you can just try to demystify that term, because I know it's a medical term, so that one understands what are you talking about.
Orthopedic surgeons are those surgeons who deal specifically with they are surgeons who operate on joints and other bone problems. That's their main area of operation, like joint replacement, fixing of fractures, fixing of complex joint problems, restoring them. So they are going to be available in all the county hospitals. That's what my prayers. Yeah.
Of course, let's take a short break. Remember that this morning we are talking to Dr. Omondi Oyoo. He's a consultant physician and a rheumatologist, and as well a lecturer at the University of Nairobi. We're talking about understanding arthritis and the types of arthritis, and what you need to do to ensure that you get the proper medication for that particular disease that he says is a silent menace within. Let's meet after this short break, because we want to talk about arthritis in children and understanding what you need to do to ensure that you keep arthritis at bay. Stay tuned to Good Morning Kenya. Welcome back to Good Morning Kenya. Remember, this morning we are talking about matters arthritis and the various types of arthritis and what you need to do to ensure that you get the right medication. And this morning we are talking to Dr. Omondi Oyoo. He's a lecturer at the Department of Clinical Medicine and Therapeutics at the University of Nairobi, and as well a consultant physician, and is trying to help us understand arthritis and what you need to know about it and the measures you need to do so that you keep arthritis at bay. Welcome, Dr. to part 2 of this program. And one may ask, how many people frequent, say, Kenyatta National Hospital or various hospital facilities to just try and get medication for arthritis in this country?
If you leave people who come because of upper respiratory tract infections, people with musculoskeletal disorders are the second leading health seekers. Of course, there are those with psychological problems in between. But real people are sick, upper respiratory tract infection or respiratory infections are number 1. Then, if you go to any outpatient and find many people sitting there, the second leading cause of their sitting there is musculoskeletal disorders. And this could be something in the range of 10% of people just seeking help. Yes.
Talk about what you called lupus arthritis.
Yeah.
What is this all about?
Lupus is a disorder, or immune disorder, where the body has got some antibodies. Antibodies are normally supposed to protect the body. But in this situation, they start attacking the cells in the body. It's like now you are fighting. There's some sort of civil war within you. And this affects all the organs. It can affect the brain, can affect the blood vessels, can affect the blood itself. You can just have anemia. Can affect the heart, the kidneys, and the joints. So it is, other than if you take TB, syphilis, and HIV, it is one of the systemic sort of diseases, one of the leading systemic diseases that one can face. It is commoner in young ladies of reproductive age, but can also be seen in men and in children. Let me say that in children and in men, when it comes, it is very, very severe. It is more severe than in the reproductive, the women in reproductive age. And it has got very many effects. But the chief among its symptoms is joint pain and swelling. Yes.
What about its medication as well?
The medications are available. It is even cheaper and to treat than rheumatoid arthritis, because we have hydroxychloroquine. We have some medication like azathioprine. We have cyclophosphamide, mycophenolate, phenolate, mycophenolate, mofetil. And this mycophenolate, mofetil is the more expensive one. But hydroxychloroquine, methotrexate, azathioprine are relatively cheaper. So it is much more cheaper to treat. The only thing is that it is a more profound in terms of its symptoms and severity. Yeah.
You talk about it being common in women. Do you have any reason for that? Or young ladies, that's what you said.
Yeah, it's because of the main thing is a genetic problem, but within that age, the hormonal milieu in the body favors its manifestation. So that's why it is commoner there. And you see it less commonly in women who have reached menopause. Yeah.
Then you did talk about arthritis in children.
Yes.
Why? Because many people expect that as you keep aging, that's when you have these complications, the joint problems and such things. Why among children?
Arthritis is also very common in children. Among the chronic diseases that children face, is among the top 10. And you have various types of arthritis. But the chief among them is the traumatic arthritis from playing and getting injured. The second one is infections, septic arthritis, the infections of the various joints that occur. Then in the developing countries, we still have rheumatic fever and various infections like viruses can affect children. But we also have specifically arthritis, which are autoimmune in nature, which affects children, which can affect a few joints or multiple joints, and they can also have antibodies, which is almost similar to the rheumatoid arthritis that we see in the adults. Finally, they can also have the lupus can also occur in children and can be very serious. So arthritis does occur in children and is something